All right.
Fitness4Life Physical Therapy. That's where we are. And we're coming to you for our first exercise for.
All right, so first joint we're going to cover is, let's talk about shoulders. So if you are going to have to get shoulder surgery, there's things that you can do usually, again, if it's okay with your physician, but depending on what type of surgery you're going to get. So a lot of the ones we see are rotator cuff repairs, okay? And so typically, what the first thing that we recommend, try to maintain your range of motion, because people have a tendency to lose range of motion after surgery. And the better you maintain that going in, usually the easier it is to get it back. So our first goal always is try to maintain as much range of motion as you can, but without overdoing your shoulder. This is not no pain, no gain. So you want to keep your shoulder pain to as minimal as possible and still keep it functional.
If you get pain, then your shoulder might guard and lock up, and you might be doing more damage than good.
Correct. So your brain perceives that as a threat. So your brain will tighten everything up trying to protect that joint and won't let it move. So everything should be done slow, easy, and deliberate. So a couple exercises we like for, say, a rotator cuff repair or labral repair is general range of motion. So one of the exercises we prescribe all the time is just get yourself a ball, a kitchen counter or a table, and just put the affected arm on it, and then by just bending forward at your trunk, you can just slide forward, because as Brian slides forward, it's taking his arm up in an overhead position. So if you look at it from this side, his arm is now coming up almost in line with his ear. That's the same thing as if he stood here. But this is a lot easier because you're taking gravity away from it, so you don't have to activate those muscles so much, which may cause pain. Now, going into that range of motion, you would stop at the point where if your pain gets more than a 2. Okay, that's kind of like what we like. Second way to use that ball is just rotating in and out. So you can stand, put your arm on it, and just rotate circles. Very easy to do.
You can progress by doing bigger circles or reaching a little farther if it's comfortable.
And usually for those type of surgeries, staying down in the lower ranges will be much more comfortable for you. A progression, if you can tolerate it, take yourself a piece of pipe or a golf club or a cane. Put it in one hand, and you can use your good arm to gently raise it against gravity, so you can work on range of motion that way if it doesn't hurt. Okay? Same way, you can put it at the side, work on rotating your arm out and in. If that is too much for you, if your shoulder is too irritable, lay on a table and do it overhead. That takes gravity out. So a couple suggestions for trying to maintain range of motion, which we find is most important. Further questions?
Contact us at fitness4lifept.com.